Yes.
Okay, perfect.
Yep.
All right. Good morning, everyone. Thanks so much for the opportunity to join your meeting, and I will try and keep it concise. I always had to prune out a lot of slides, so if I end up not touching on the things that you are most interested in, make sure you just flag those issues and questions, and I will try my best to answer them. I'm a public health veterinarian, so some of the very human health oriented pieces I will do my best to summarize, but it's certainly not my area of expertise, and I could always bring those questions back to my physician colleagues if there's other things that you would like to learn about. So what I thought I'd do is just give you a bit of a background on rabies and then our approach in BC, and some of the surveillance data that we have. So I'll just dive right in. So, historically, it's one of the oldest described diseases. And it actually, the word rabies originates from the Latin word rabire, which means to do rage or to do violence. And the Greeks called rabies lissa or litta, which means frenzy or madness. And thus the type of virus is a lissavirus. It's in the genus lissavirus and the rhabdovirus family. This image here shows that there's quite a few related viruses in the lissavirus genus. Many different species there, and then grouped into different phylum groups. The ones that are circulated there are the different variants of rabies around the world that affect many different species and a reservoir of different species, which we'll get into. So it causes an acute progressive encephalitis. It is 100% fatal if it's contracted, but it's also preventable with rabies pre-exposure and post-exposure prophylaxis. All mammals are susceptible. It is an envelope virus, so it can be inactivated quite readily with UV exposure. Essentially, when the virus dries out, it is inactivated because that envelope does break down readily with UV exposure or exposure to other sort of disinfectant type of solutions like bleach and ethanol and ammonia and iodine solutions. So there are many different variants of rabies. There's a couple of graphs here. The one on the left is quite blurry, but it does show you the different variants that are reservoir in wildlife species in North America, and terrestrial wildlife species in North America is the one on the left. So we're seeing Arctic fox in red across the north, and then there's different varieties of skunk variant rabies, raccoon rabies more on the east coast in that dark green, and then there's mongoose in further south, and so there's a variety of different ones. In Canada, you can see the graph on the right, which highlights in the sort of hash marks across the country that variant rabies that is goes right across the country, and then we have specific variants. In the north, fox covering most of the north, and then we've got skunk variant in the middle, and then in very select areas, raccoon variant rabies out in the east in Ontario, and a little bit on the east coast. So from this, you can see that BC doesn't have the only variant that we have in BC is the bat variant rabies. But just because it is hosted in a specific species, it can spill over into other species. Thus, we can sometimes see bat variant rabies in cats. We have seen bat variant rabies in humans, skunks, for example. So, but the host species is what they call the variant. Globally, really, it's canine variant rabies that causes the most human deaths per year. So this estimate, which is probably quite out of date now, due to underreporting, but there's 60,000 human deaths per year reported from rabies, and these are predominantly in Asia and Africa, and those would be almost entirely canine variant. So as I mentioned, bats are the only rabies reservoir in British Columbia. Our best estimates on how common it is that it's we say less than 0.5% positive. It's probably even lower than that. There's been some work done in the past. It's very difficult to get a true estimates in wild populations, but it is very low. It is prevalent throughout the province. So we don't have any sort of rabies-free areas, although we do hear that sometimes to say, oh, we don't have rabies in our area. But it is present in very low levels. We'll get into some of the surveillance data that shows that of the bats that we test, we actually see a higher percentage, but there's reasons for that. That's a bias in our surveillance system. So we'll get into that a little bit. So just wanted to summarize in Canada, the number of human rabies cases. So there have been 26 cases across Canada reported since 1924. Only 2 of those have been in British Columbia. The most recent one was in 2019 on Vancouver Island due to a bat exposure, and another one in 2003 that was, I don't know that one was even typed, but it was, and I don't think there had been travel history, so most likely that would have been bat variant rabies as well. The last time in Canada when there was a rabies transmitted from a non-flying animal, so a non-bat species, was back in 1967. So in Canada, all the human cases have been due to, since then, have been due to bat exposures or exposures from travel. So individuals that have been bitten by a rabid animal while traveling, and either in other, most likely outside of North America, but potentially that could happen from exposures in other parts of Canada that have terrestrial rabies. And okay, so here's some of our surveillance data. So this one shows the number in the sort of gray bars. Those are the number of submissions that are sent to the rabies lab. These are all species, not just bats, because we do get other specimens sent to the rabies lab. The majority of these are going to be bats, but there might be other wild species. There might be cat specimens, and here there might be dogs that had neurologic signs and so on. So you can see that we've had anywhere from 50 or 80 submissions up to as high as over 300. That latest peak in 2019 was very much as a result of the human rabies case that we had on Vancouver Island. And so in pink on this is the percent of those specimens that are positive, and the dark blue are the actual number of positives. So very low, very steady, no real changes over time other than some of these peaks in submissions due to some kind of event, usually that is pervasive in the media, drives those submissions. And then this graph shows you the submissions to the rabies lab by month. And you can see in that dark blue was 2019. So we saw a significant increase in the number of submissions. This increase would have been almost exclusively bat submissions as a result of that report in the media. But you can see that generally we start seeing increases in May, June, peaking in July and August, and then starting to come down in September, and really being quite minimal throughout the other sort of later fall and early winter months. So yeah, just seasonal increases as you would expect with increasing activity of bats. So just in summary, so we generally have had, like, the number of rabies positive specimens in BC has remained very low. We get anywhere between 95 to, in some extraordinary years, up to 500 specimens per year. Of those that are submitted, anywhere from 2.5% to 12.8% are positive. So a median 4.6% of those are positive. And the majority of those that are positive have been bats. As I mentioned, we have had a couple of spillover cases in domestic cats, skunks, and those several human cases. So the numbers that we put in our guidance around the percent positive bats I included that here. Did I include that back here? Yeah, so 1.2 to 13% of bats that have human or domestic animal contact are positive. So on average, we say sort of between 5 to 6% of the bats that we test are positive. And that's because the bats that are in fact positive are more likely to come in contact with an animal or a human, and therefore it shows as a higher percent positive, whereas in natural populations, the percent positive rabies is very, very low, that under 0.5% that I mentioned before. So just coming back along here, so I just wanted to talk a little bit about how it's transmitted. So rabies, the virus is introduced through a bite wound somewhere in the body, and then it starts to replicate in the muscle tissue. So, and it can do that for many weeks or months even. And then at some point, and again, what is the trigger for this? It's uncertain, but then it starts to ascend up the axons up to the central nervous system, and then goes up to the brain, where then it starts replicating and once it gets into the salivary glands. And the virus is really only located in either saliva, because it's replicating in the salivary glands, or it's in central nervous system tissue. It's not found in blood or other tissues. Those are the main sources of infection. So in animals, clinical signs can be extremely variable. It may be as simple or as sort of behavioral changes, but it can progress very rapidly. So they've got different forms, and sometimes one moves into the other, like in terms of that furious, what we think of as classic canine rabies, that aggression and hypersalivation and seizures, loss of muscle coordination, and then that can progress into that what they call the paralytic form, where they essentially progresses through increasing paralysis and then leading to death, but it doesn't mean that the furious form always occurs. It can, manifest as that paralytic form without going through that furious form, and it's quite rapid progression. So I'll just sort of run you through how the virus progression happens. So that incubation period can be quite prolonged. It can be as short as 7 days and as long as 6 years. But the average is 3 to 12 weeks that the virus can be incubating in the body before it starts doing that, ascending up to the brain tissue and getting into the salivary glands. There is a period that is known really only for cats, dogs, and ferrets, where the virus can be in the saliva and be infectious. So if a rabid animal was to bite a person, but they may not be showing clinical signs. So it can be a 10-day window where they show no clinical signs, but the virus is active in their saliva. And then the clinical signs progress. At the absolute longest, especially for dogs and cats, is what we have sort of evidence based on, that it's less than 10 days. And usually that would be at the absolute longest. I think the evidence shows that most of dogs or cats would perish within 6 days, sometimes a little bit longer. So it always progresses to death in those situations. And I think I mentioned this, they can have that no symptoms, but viral shedding but this is only known for dogs and cats. It likely happens in other species, but there just isn't the evidence base to support that. Very difficult to do research on this virus in real time. So in bats, a lot of unknowns, and I am certainly not a bat specialist, so I was trying to get a little bit more information on just how the pathogenesis in bats and the idea of bats as a reservoir host. And really there's not a lot of understanding of how it is just how bats act as a reservoir. There is evidence that in some studies that they have detected antibody to rabies in some bats, which indicates that they had been exposed but did not succumb to the virus. So I think there is some evidence to support that they can be exposed but not necessarily develop full-blown rabies. Once they do develop clinical signs, then they would progress to death. I think, and again, the clinical signs very difficult to detect in bats. Can be just behavioral changes. So, just changing their activities, maybe found in unusual locations, inability to fly, more easily approachable. But it can have symptoms similar to what we see in other animals in terms of weakness. They're not eating. They could be aggressive, but again, that's not classic. They can just act incoordinated. From a couple of resources I looked at in terms of what is that period for clinical signs, and it seems to be around the range between 4 and 20 days, so which is longer than what we see in other species. And again, we have lots of questions of can they be shedding the virus without showing any of those signs that as indicated. So I think we make assumptions, based on risk management that is possible, but we don't know. So in BC, we have a rabies management program. So BC CDC is the lead agency for just making sure that we have the resources in place and guidance in place to be able to respond, but it really is a shared responsibility across many sectors, including the community vet program and vet clinics and health authorities and so on, and partnership with the CFI Rabies Lab. And we also work closely with the Animal Health Center Lab at the Ministry of Agriculture. So definitely there's a lot of communication and coordination when we're responding to different types of exposures. This schematic is busy to look at, but it essentially breaks down, when there's been human exposure, what are the steps that have been one should take, and what to do. And then if there's been a domestic animal exposed to a potentially rabid animal, which in BC is almost exclusively going to be a bat. And then what happens if both of those things happen? So we have lots of resources that can point towards these things. And I think your sick and dead bat protocol outlines these very well. And I think I would underscore how this is just such a valuable resource for us and for your team as well. And I think we very much appreciated the partnership and being able to contribute to this document. So certainly, understanding what constitutes a close contact, and that's really, certainly being bitten or scratched, or exposure of any part of the bat to an open wound, or in some situations it just might be you encountering an individual that just has a high level of concern, even though the risk might actually be quite low. And so what are some of the follow-up mechanisms to that? So we recently in the last year now have a team behind our public health vet email, which is very helpful to me because it was all phone-based before. And so they've got a lot of sort of SOPs that they responding to different situations and know the right contacts. And so I think, if there's any concern, certainly that's a great place to start. And then linking with the appropriate health authority, should there be human exposure and so on. So if there's a human exposure, and this applies to domestic animal exposure too, there's a series of steps around doing a risk assessment that, for example, a health authority would undertake. And first of all, would be trying to understand, has there been what we consider a direct contact? And that's essentially unprotected contact with undried out, undesiccated saliva or any kind of neural tissue that could have been an individual could have had introduced into their body. So, or have contact with the mucous membranes, or a bite or a scratch, or those kinds of things. And again, repeatedly, we've seen the challenges of understanding if there has been a bad exposure that fits this criteria, given the very small size of bat bites, and if that happened on someone's head, and trying to decide if there's been an exposure just with someone's trying to see a bat bite on somebody's head or other parts of the body can be very difficult. So the medical health officers and their teams go through sort of different things around, if they've confirmed direct contact, then they think about geography and the animal species, animal behavior, types of exposure, and the body part exposed before they decide what they might do next. We know that in areas that are highly like have tons of nerves, like our hands, our faces, those areas are more of a concern, just because the virus can ascend more quickly up to the brain. So it's urgent to be able to respond to those in a very expedient manner. So we've got some resources on our communicable disease guidelines that sort of categorizes different risk or different species under risk categories. We've got this table that talks about exposures that occur within BC, and then we've got a separate one of exposures that have occurred outside of the province. And bats in all scenarios fit under the very high category. And so the public health would recommend sort of immediate post-exposure prophylaxis, potential animal testing, and then they can discontinue that if the animal tests negative. And then cats and dogs fit in sort of other lower categories. So in responding to rabies, it's certainly, the risk is there, is a very severe disease, but there's also recognition of, we try and include these materials when we're doing any communication about bats and rabies, that, just the ecological benefits of bats. We know that they have very important roles in terms of biodiversity, and we know there are conservation risks associated with it. So we really try our best to balance these things, but there are also, very severe consequences in not doing testing when testing is warranted. So we try our best to balance those pieces. Just wanted to talk a little bit about pre-exposure immunization. So again, this is in our communicable disease guidelines, and there's different categories of risk and what is recommended in terms of pre-exposure immunization. I've highlighted in green there where wildlife biologists and wildlife workers that work in enzootic areas. So areas where there is rabies, and BC is one of them because we know we have bat variant rabies. So this is where individuals that work with bats, we do recommend an initial series, and then serologic testing every 2 years. And then once a booster immunization when antibody levels get to be less than 0.5 international units. And then the high risk category is really for rabies research lab workers, those that are working with, biologicals and so on. And then individuals that are doing a lot of handling, fit within this high risk. It kind of, it depends on the type of interaction that one has. So, and also the medical health officers will advise based on the types of interactions that one has. And in that high risk category, it's, serologic testing every 6 months. So, but for those that are working, it would depend on the types of interactions is what I want to summarize there. So I think just some key messages. So certainly understanding and following the BC sick and dead bat protocol. And then, understanding where one sits with a pre-exposure immunization, as I mentioned, and then just, taking precautions around being bitten to prevent being bitten or scratched, whether that's through protective clothing or bite-proof gloves and so on. And if bitten or scratched by bats, or the recommendation is to do immediate first aid, so washing with a mild soap and flush the wound with like copious amounts of water under moderate pressure for quite a long time. So they recommend 15 minutes. Some may recommend doing a disinfectant step, so really trying to do the best to deactivate that virus in the as close to the event as possible, and seeking medical attention. There are a number of, I won't go into the post-exposure treatment, but for those that have pre-exposure vaccination, they still recommend a post-exposure, but it's fewer injections. I think it's usually a 2-dose schedule versus those that are completely unvaccinated would have, and then there's different schedules. I won't get into that here, but there's usually a four dose schedule with also a what they call rabies immunoglobulin injection as well into the site of the bite or the scratch. So there's still that post-exposure treatment, but it is less so for those that have that pre-exposure prophylaxis. So with that, I'd be happy to take questions. And again, I just wanted to acknowledge all the different agencies that we partner with, and I will stop there and stop sharing my screen. Anybody have questions?
There's a couple. Thank you, Erin. That was really informative. I see there's a couple of questions on the chat line. One is, does reservoir mean that that species can be an asymptomatic carrier? I think that was.
Yeah. So possibly. So in bat species, not in other species. They don't find that, like, for example, raccoon variant, the evidence is that no, that once they have it, they would develop clinical signs and perish. But because they're quite aggressive and they do bite other, and that's how the virus is passed on. There's uncertain evidence around bats because, as I mentioned, some of the studies show that they have had exposure by looking at their antibodies in their blood and see that there has been a history of some kind of exposure. So it's quite uncertain in bats.
Okay. Elodie, do you want to continue with your questions since that was one of yours and you have your hand up?
Sure I can. Daniel was first, but I can go quick. I have 2 or 3 questions. My first question is, like, let's say someone has a pet that get bitten by a bat. This animal can get rabies. Can it transmit it to humans as well?
Yeah, so it potentially, yes. That the examples of that are very far and few between, but yes, if it could be passed on subsequently. It's like if the cat was to get infected and it wasn't vaccinated and developed clinical signs, and then yes, it could potentially pass that on to another animal, another human.
Okay, so basically all
examples of that are extremely rare, though.
Okay, so but all the variant could go to any kind of mammal. Okay.
Yes, it can. Yeah,
and
it just the variant has to do with who is the sort of host of that, and it's more adapted to those species.
Okay, my other questions, when someone has been scratched or bitten or think that there might be some kind of contact, and they have the bat and it's still alive, how much does it make sense to actually send it for testing, because the bat's going to get killed, right? Is the result for that bat, if positive or negative, going to come soon enough that it makes sense to know for that person if they have to go to a house or a medical appointment or not? Like, is it soon enough that it makes sense to know?
Yeah. And I think there's, different health authorities approach it slightly differently. I would say that some health authorities have a very expedient way, because through partnerships, to be able to euthanize the bat and get it sent for testing. Once the rabies lab, there's only 2 rabies labs in Canada, and our closest one is in Lethbridge, so they would have to get it there quickly. And then once the lab in Lethbridge has the bat, they will have the result within 24 hours. So they can. Other health authorities, Fraser Health, for example, seems less inclined to do the testing and move directly to the post-exposure prophylaxis.
Okay. So yeah, because I've been asked many times where they should send it, and I'm in Nelson, so I'm far from both sides. I'm not sure they can have the result within the 24 to 48 hours that people need to do their prophylaxis anyway.
Yeah, and usually, so what Health Authority would do is they would, you know, depending on the exposure, the type of exposure, where the exposure occurred, all, you know, all the things they look at, as I mentioned, they would start the post-exposure treatment and then discontinue it with the results. But it does depend on, you know, it is a collaboration with the Health Authority when we've got human exposures on what their protocol is, because if it's in a very remote area and getting it shipped to the lab is going to delay it by too many days, they probably would opt not to test and just move straight to the post-exposure. But that's done in partnership with the Health Authority, that decision making.
Okay. Sorry, last question. So if the health authority doesn't necessarily want to send it, what should we recommend as that people? If the person say, hey, should I send it or not?
Yeah, it would either be, and again, sometimes it can be two things at once, right? If there's been human exposure and if there's been a domestic animal exposure. So I think it's going through to see if there's been neither of those. And it's outside of the, you know, the white nose surveillance window, then there's no, did I say white nose syndrome? Am I saying that right? Then there'd be no need to test that bat. So it could be, if it's healthy, then it could be safely released, or, you know, if it is not well, then trying to find another mechanism for euthanasia or even rehabilitation if there's a facility in the area.
Okay. No, thank you. That's all for me.
Hey, Danielle, thank you.
Hi, thank you. It's good seeing you again, Erin. Thanks for your
Yes.
presentation. Just to answer Elodie's question, I always tell people it's not our job to tell them what to do with the bat. It's the public health to tell them whether it gets tested for rabies or not. We just give them the advice. Anyways, I have 3 questions. I was wondering one about, last time you presented, I asked this question and there was really no research about it. And it's how long after the bat sits on the wall does the saliva take to dry up before people need to be worried about it? I am doing outreach to climbers next weekend. And this is going to be a question on people's mind is as they're climbing up the walls, do they need to be worried if there's bat roost? Has any research been done to know, like you said, the virus isn't viable when it's dry, but do we need to worry about that?
Yeah, I suppose, you know, on a rock face, you know, if somebody had, which I would think climbers would have many cuts on their hands, like it does break down quickly. Like I would think that it would be on a rock face break down very quickly, but it's very temperature dependent. And you know, I think that would be quite low risk, but unless they saw areas that were like, are they in caves or are these are like out like?
Well, they could be, you know, in a cave entrance. They could just be along a cliff edge. I mean, I have homeowners ask me that too. Like after the bat sits on the wall in their house, so they need to like, you know, totally bleach all their walls and, you know, they're paranoid about it. And I say it's very low risk, but I was just wondering.
Yeah, I would agree with that, saying it's low risk. Like it's not zero risk, but to me that would be quite low risk.
Okay, I just thought I'd ask again.
Yeah, no, there's not a lot of evidence on that. And it's variable. I think that's the you know, it just depends on the climate and where it's situated and is
so dry, hot breaks it down sooner, I would assume.
Yes, that would probably be a safe assumption to make.
Okay, guys, we only have 3 minutes left, Danielle.
Okay. Okay.
We can always email her with extra questions.
Perfect. I was just wondering, a lot of people tell me about the raccoon outbreak of rabies in Stanley Park. I know nothing about it. I've never heard you mention it. It was
skunks, actually. Yeah. We've had I think there were 4 cases back in like 2004 or something like that. And they were, I don't know if the variant testing was done at that time, so they've done more genomics testing of the rabies virus, and we have some of that data. I don't know if those cases were in there, but they would have been almost, like, I could almost guarantee that they were bat variant. And then we've had another skunk case in the interior several years ago, also bat variant.
Okay, thank you.
Mhm.
Okay. Jenny, your last question. We might get cut off. We have 2 minutes.
I'm fascinated with the whole reservoir, and thank you so much for this talk. It's great. But the reservoir issue, it's just interesting that, you know, with all of us vaccinated, and my titer's always been so high, it's over 3, that they thought I must have rabies. And the physician's answer was, I may be getting a minimal dose exposure over time because it's been so long. I'm also a vet, so I was vaccinated for years.
Mhm.
It could be that. And so it's interesting to wonder if some of these bats aren't also getting vaccinated, and that's their
Mhm.
level of antibody in their
Mhm.
system. It's fascinating.
Yeah. And I
Especially
actually just read a paper this morning. I know we're gonna get cut off, but there was an interesting paper that I read that it was an experimental study, but they looked at subcutaneous exposure of bats and intermuscular, and the ones that had subcutaneous exposure were more likely to develop rabies, where the ones that had intermuscular didn't, but they were more of a priming, which is very interesting. So I
Wow.
do think that happens. Yeah.
very neat. Thanks so much again. Great talk.
Mhm. Wonderful.
Yeah, thank you very much, Erin. I think I'm gonna say if anybody else has any questions, Erin, is it okay if they reach out to you?
Yes, of course. Yeah, definitely reach out to me.
Wonderful. Thank you
Thanks
so
for the
much.
opportunity. I hope everyone has a great day.
And thanks everybody for attending, and
Mhm.
hopefully that works, that I can record it and I'll save it somehow, and we'll be in touch in October for Bat Week for our next Zoom meeting.
Great.